Start up here. Okay, so today we're going to work on posterior kinetic line. If you guys remember posterior kinetic line, before kinetic line, I want to talk about pain because a lot of clients come to the clinic and they don't even know what the pain is and how massage therapists can explain what's the pain is. So let's say people come in and I usually work on people. Oh, no, I have to take this here. I work on people and they don't know what they experience. So I always ask them questions. What do you feel? How do you feel that? And they try to describe that. And from this description, I understand what they experience. So I want to just share this with our clients, people who would like to work with us, who come to our clinic and receive that therapy, because we're completely different than regular kind of massage place. Manual therapy and pain management therapy, it's completely different when it's just a regular massage therapy. We also do lymphatic drainage therapy, which is great for our immune system and just for their general health. So pain. Most people come in and experience, what do I want to say? Pain. So pain could be muscle pain, nerve pain, organ pain, and joint pain. Let's describe the muscle pain. So sometimes people come in and they describe it like, I feel this pulling sensation, I feel like a tension. Sometimes what else can be? Help me out, guys. So I have people behind the camera.
It feels stuck. It feels
it feels stuck. So
Yeah.
they're not movable. And what they do, they said, I asked him the question, so are you done anything and it's helped? They said, yes, I'm just kind of like try to stretch, do a little bit exercise, and it's helped me to release that. This is what's the usually muscle pain. And it's not that big a problem in the beginning, but later it could be the problem. Why? Because just think about it. If I do any like everyday routine, my like work or exercise, one muscle feels sore or tight. So what's that mean? That's mean you use this muscle too much. This muscle is overloaded and some other muscle is not working at all. So that's why Massage RX, Life RX, they will do some spatial assessment. They will find out which muscle is weak and try to restore that muscle, reactivate that muscle with a specific manual therapy, with massage, or even exercise, or sometimes we use even bands. So can be restored and balancing your postural. If you ignore this kind of pain, you don't do anything. Most of the people, what they do, they take ibuprofen, right? They take Tylenol. Exactly.
Aleve.
Exactly. So what's that mean? You guys cut it off, that sense of sensation of this pain location to your brain. So you just cut it off, disconnect it, but the problem is still there. You don't do anything for the recover this problem. So that's what the manual therapy about. So don't ignore your muscle pain. Of course, call massage therapists, call manual therapy, chiropractors, and do this, like correct it. Get this muscle tone back. One, it's nerve pain. Most of the time, people come in the office and they describe that pain like a sharp pain. It's so painful. People contract the muscle and they feel this tingling, numbness. Sometimes they feel that transferring pain or shooting, like I just described. Let's say it's shooting down your fingers. And guess what? Then what most therapists gonna do? They're gonna try to chasing that pain. Like I said, maybe they're shooting down, they're going to work on here. But the problem is it's completely indifferent area. It could be in the neck area, could be in your thoracic area, maybe your brachial plexus nerve being jammed. Maybe that's a rib problem. And that's what the nerve pain is. And like I said, sometimes it's sharp, and we usually level the pain. And if I ask people, let's say from 1 to 10, what's the level of this pain? If people tell me like 7, 8, I'm going to be super cautious. I ask a lot of questions about what's going on. Are they done anything? because this is serious. And if I be a massage therapist, like I said, even maybe send to the doctor and get that referral, and people come back, because I know ton of stories. People, massage therapists, try to help this kind of type of person with this shooting pain and make it worse. Why? Because we don't know what's going on in the lower back or neck. It could be the serious problem, and we apply a little bit pressure and make it even worse. So don't put yourself in this dangerous situation. If you get those nerve pain, people, level 7, try to, like I said, be very cautious, super, take your time, pay attention. That's the key. And for client who have this type of pain, I'm highly recommend to do action right away. To do action, to call doctor, MRI, X-ray, and just find out why it's a tingling, why it's a numbness in the fingers, or that shooting pain, transfer pain. Next pain, it's an organ pain in the organs. I usually, like I said, it's not our scope of practice, but if people describe like a kidney stones, I'm definitely send them away to the doctor, and just I don't know, I'm gonna say cautious and super careful with this kind of stuff. But yeah, massage therapists don't deal with the organ pain. Joints, sometimes we have the swollen joints. What's the swelling, inflamed? This is another thing. What massage can do, they can increase the range of motion of your joints if this has been jammed. Maybe that's the postural problem, or sometimes even bacteria. And that's what the therapist can help you with. So if you experience all this type of pain, the pain means something is happening with your body, and you need to take action right away. The first step, if you are in a muscle pain, and if you like in joints radial motion problem, you definitely can go massage therapist and see if this is going to help. If not, like I said, do further action. Doctor, physiotherapy, combine all together. Stop ignoring pain, because if you keep ignoring pain, it's going to create more problem. It's going to compromise more part of your body. Let's say my neck hurt, later is going to be shoulder, lower back, foot, everything. And guess what? This constantly present in pain going to create more problems, like fibromyalgia, migraines, headaches constantly. You're not going to be happy with your life. You're going to be constantly in pain. So this life is all about you, about experience, positive experience, not suffering, and that's the key. You guys have anything to add with all this pain management stuff?
People mask it so much they don't even know what's real because they keep taking medication for so long.
Yeah, he's diving so deep because yes, most people don't know where they are. They know their first name, last name, they're female, male. they born in the United States. They know that. What's the race, like color, but that's probably it. When you ask them to do something, they're not capable to do, but they think they're doing that. So people don't know where they are and what's the condition of the body. If you ignore it for a long period of time, your body, trust me, you don't know what's going on. And you need to connect it to yourself. You need to go back to yourself. How are we going to say? Aware of your presence in this life. And if it's not happening, I saw a lot of drama and tragedy stories in this life. So you don't want to be there. You don't want to be in this thing.
And they're compensating. If there's a problem on their right side, they just compensate with their left and think it's all okay. After a month, 2 months, they think that using their left and nothing on the right is good.
Exactly.
They don't even know.
the God designed you equally, left, right, and side. Like if I don't use my left side, I start using my right side a lot. So what's going to happen? My right side is going to start give up. Let's say me and David unloading a truck of potato, like 1,000 of bags, and after unloading 100 bags, I'm going to say, you know, David, I think a little bit tired, so I'm going to go sit down. And David is going to unload all this truck. Guess who's going to be sore next day and going to be in pain? Me or David? Of course, David is going to be, and he's going to be complaining on this. And what's the therapist do or doctors? They're going to treat the David, but the problem in me, because I was the lazy and sit down on the couch and I didn't do unload the potato, but he did the whole work. And why you treat the David? You have to treat me. That's what the problem. That's why we do morning exercise. We try to help you guys with this muscle activation and
assessment too.
Assessment, yeah, of course. That's why we do these classes where you can learn about how to assess yourself, how to assess your relative, your husband and wife, your daughter, your everyone, your relatives, your friends, and you can find out what's going on with this problem and guide them to tell them like, hey, you know what, your hips is out, so we have to do something about it. If you keep ignore that and keep people walk like this with this unbalanced hip, what's going to happen? It's going to go up. It's going to get some damage to the spine. It's going to create that kind of stuff, bulge, herniation, and that's going to go further and further and further. So what we try to tell you guys, stop ignoring your pain, because this is the messenger. Don't kill the messenger. Let the messenger send you the message, correct it, and get rid of this pain. So that's all about. And if you need help, we here, Marina, David, me, we're here to help you. Come to clinic. You can walk. We can come to your house. So this is what we do. You guys want to add anything, or you good?
I'm good.
You good?